Good afternoon, everyone. It is truly an honor to stand here today as the sponsor of House Bill 421, a piece of legislation that will save lives across Kentucky. This bill is more than just policy, it's a promise to Kentuckians that we are committed to early detection and prevention, ensuring that no one ever has to face unnecessary barriers to life-saving screenings. As a survivor of early age onset colorectal cancer, this fight is personal to me. I know firsthand the importance of catching this disease early, and with House Bill 421, we are making sure that high-risk individuals have the access they need when they need it. Kentucky has long been a leader in colorectal cancer prevention in the United States, and today we strengthen that leadership. By expanding early screenings and removing financial barriers to colonoscopy preps, we are setting a precedent for other states to follow. And we are doing it together with overwhelming bipartisan support, with the backing of healthcare professionals throughout the Commonwealth, and with the immutable voices of advocates and survivors who have worked tirelessly to make this moment a reality. I want to extend my deepest gratitude not only to Governor Beshear for signing this bill into law, but I also want to thank my colleagues in the General Assembly for their unanimous support, and to the many organizations and individuals who have championed this cause. I especially want to thank Dr. Whitney Jones, and the founder of the Colon Cancer Prevention Project, for his relentless dedication to this cause. His expertise, advocacy, and passion have played a critical role in shaping this legislation and advancing colorectal cancer prevention efforts, not just in Kentucky, but across the nation. House Bill 421 is about saving lives. It's about ensuring that families across Kentucky don't have to suffer the loss of a loved one to a preventable disease. And it's about proving that when we come together for the health and well-being of our people, we can make a real, lasting impact. Thank you all for being here to celebrate this milestone. Today, we take a bold step forward in the fight against colorectal cancer, and I couldn't be more proud to be part of it. Thank you.
It's hard to follow Dr. Neighbors, almost. Thank you very much. I also want to say thank you to all of the people that have helped us get here today. Governor, of course, has been a great and tireless champion, as was his father, and helped to actually implement the program. Rocky Atkins, who's been a cancer survivor himself and knows the importance of early detection and screening, and we've worked together for so many years. It's just been amazing. Representative Neighbors and Senator Steve Merritt, who pulled this across the Senate. I want to thank both of them, as well as the leadership in both houses and Senate. It's a great honor that this is one thing that brings Kentucky together, which is our battle against cancer. We've been making great strides in lung cancer and colon cancer, and really setting the mark, I would say, for many other states who face the same things. A lot of the work that we've done has helped southern states as a whole increase their screening rates more than the rest of the nation in terms of our average. So the southern states are doing great. I want to thank a couple of people specifically who helped us here: the Kentucky Medical Association, who supported us, the Kentucky Hospital Association, who employs most physicians. So it's incredibly important to have that integrated process from primary care to gastroenterology there. University of Louisville, as well as the University of Kentucky Cancer Center leaderships with Dr. Jason Chesney and Dr. Mark Evers were both incredibly helpful in writing supportive letters. And I want to recognize Tad Dryden, who's the governor from the American College of Gastroenterology, who's here today, for the first states implementing the Multi-Society Task Force guidelines, which really are going to allow us to go on offense with colon cancer and not play this game from my 5-yard line, but to get into the opponent's land and start playing offense with that. So that's really, really important. And I want to recognize all the folks from my organization, of course, our team, Misty Renault, Amanda Smart, our board of directors is here, many of whom are young colorectal cancer survivors themselves. At least half of our board is made up from folks who are doing this. And so it's really a great day, and it couldn't have happened without all these people. But we've been plagued by colorectal cancer for as long as I've been a physician, way back into the 90s when I first came back to Kentucky. And because of that, we have the highest number per capita of high-risk patients compared to any other state in the nation. So it's fitting that we would implement the most advanced and proactive high-risk legislation and guidelines for screening in the nation. And what that essentially is going to mean, if you have a family history of colorectal cancer and a first-degree relative or multiple second-degree relatives, or large polyps, advanced adenomas, big polyps, because we want to be in the prevention business, not just the cancer diagnosis business, you're going to start your screening at age 40 or a decade sooner. And what that means is we need to start having conversations about colorectal cancer much, much earlier than 45. 45 is the finish line. It is not the starting point for communication around colorectal cancer. Like breast cancer in women, we have to begin to have this conversation as adults lifelong to understand your risks, understand when symptoms develop, understand when your risk-based screening needs to happen. And again, by bringing the whole ecosystem of healthcare in Kentucky from the payers, and again, I want to recognize all the payers who were with us on this. We went through the Defrayo process. I think we were the first bill to go through the Defrayo process. And again, they said this is going to save money in Kentucky, more than likely. But I want to really thank the payers, and particularly Elevance, known as Blue Cross and Blue Shield, for helping us through it. And again, I think this allows us to go on offense and really to focus on what it means to prevent a colon cancer. Each year we prevent about 640 colorectal cancers, and then we prevent about 240 deaths each year because of earlier stage detection. But the vast majority of both the fiscal impact, about almost $70 million annually we save in treatment costs, comes from prevention. So as we see new blood-based tests for colon that are better at early detection and not quite as vigorous at prevention, I want us to lean in on that prevention, which means colonoscopy and stool-based testing that has a high degree of detection of these large polyps, because that's where we want to fight colon cancer. We don't want to fight it. We want a lot of previvors, not a lot of, we want survivors too, but we're leaning in on the previvor piece as well. And so I'm just tickled pink to be here. It's such a great amalgamation, and what a great capstone for the work we've done and the work that you guys have done to really make Kentucky a leader in this field. And I'm just honored to be a little part of this team that can make some good headway against a chronic problem. And if I can't, Governor, do you mind if I ask the governor from the American College of Gastroenterology? Because they were the ones who were smart enough to come up with these darn guidelines. He's still a governor. Thanks. Dr. Dryden, come up here if you'd like to say a few words.
All right. Thank you, Dr. Jones. This is a fantastic time, and the seal says it all. Together, united we stand, divided we fall. So we've brought all of the legislators in the state of Kentucky together to be able to address this, to tackle this in such a forward-thinking way that we are going to be able to save lives. And again, the points that Dr. Jones brought up are so important. It's breaking down the barriers. It's getting the hurdles out of the way for people to be able to come. And I see this as a gastroenterologist. I see patients in the procedure room, taking out polyps, sometimes making the diagnosis of colon cancer when it's been unexpected. But as a Navy Reserve physician, I am counseling people on a monthly basis at our Naval Reserve Center. And they now know when they come to see me that, hey, Doc, I'm coming up 43. I know it's a couple of years that I'm going to be reaching out and going and getting my colon cancer screening. And really to be able to talk about the fact that the technology that we have in place is preventative. So we can reduce colon cancer deaths, we can reduce colon cancer incidence by going in, finding polyps and advanced polyps and taking them out, and then giving the person a clean bill of health. As Dr. Jones and I have talked about in the past, there's nothing better than giving somebody the news that they have nothing in their colon or that they have polyps that we've been able to remove. And so getting the biggest barrier, which is cost and coverage out of the way. Then the second highest barrier, improving the access to good quality preps, because we know that that is one of the biggest reasons why people will have inadequate colonoscopies. And we are now demanding the highest quality of colonoscopy to be able to assure that patients are going to get the best value for their money out of these procedures, and the payers to get the best money out of their the payments that they're making for these services. So to be able to get them good quality preps that are not excessively difficult to ingest, because there's always a joke that the hardest part about getting a colonoscopy is getting through the prep. Once you get to the procedure room, it's all downhill from there. So anyhow, I'm just very, very grateful to all the legislators and all the people that were behind this effort to be able to bring this together and make Kentucky a leader, not in colon cancer, not in colon cancer deaths, but in colon cancer prevention. So thank you very much.
Being 47 years old, I got that prep joke. Everybody, I'm going to be brief because we've got some really dangerous weather that's moving into Kentucky, and I want everybody to get home safely. But let me say that this is what government is supposed to be. Representative Nabors went through a traumatic time and has taken that trauma and has turned it into triumph, has passed legislation to make sure that other folks won't have to go through what she and I'm sure her family went through supporting you. This is looking out for everyone, living that golden rule that we love our neighbor as ourselves, and the parable of the Good Samaritan that says everyone is our neighbor. And to the Colon Cancer Prevention Project, thank you for your work. I mean, you do it with such positivity, trying to bring people on board, trying to lift people up, when what you're trying to do is save their lives. It's really special. That again, I mean, when you share going through something difficult, something that could have taken your life, it makes you pretty vulnerable. But you all are willing to share that experience and be vulnerable so that the next person coming along gets that screening and doesn't have to go through it, that they can get that clean bill of health, that they can know that they're going to have that time with their families and build great memories and not have to look at the possibility of having that cut short with their kids or their parents or others. Colon cancer is the third most common cancer diagnosed in the United States, and it is the second leading cause of cancer-related death among men and women combined. So when we have more screenings, we save more lives. Yes, we save more money, and that's important, but having people still here on earth with their families, making those amazing memories is so critically important. And the idea that 60% of colon cancer deaths could be prevented through regular screenings, that's 60%. That's 6 out of every 10 people we lose could still be here with us today. I know what it's like to have a close family member with me, my father, sit you down when you're 17 years old and tell you he has cancer and that he's going to go in for an operation. If it's successful, I think everything's going to be okay. And if it's not, it's going to be a very different life. I don't want other people to have that discussion. I want everybody to get these screenings so that they know that they're around for their kids or that they're going to be able to be here to make those memories with their parents. So, Representative, thank you for passing something that lifts everybody up, includes everyone, and looks out for the health of all Kentuckians. So with that, this isn't a ceremonial bill signing. This is an actual bill signing. So when everybody comes up and we do this, this is actually signing this into law. I think this is one of only 3 we were able to do during the session. So, Representative, if you want to pick out who you want up here, let's bring them all up and let's make it law. Congratulations.
All right.